Now, intracytoplasmic sperm injection is done in cases where the egg reserve is very low, where we have only limited number of eggs, or where there is a severe male factor, or sometimes in cases where there is no sperm in the semen sample and we are taking the sperms from the testes directly by the procedure like TISA or micro TISA, or in cases where IVF has not resulted into fertilization. The failed fertilization by IVF patients are also taken for the ICSI. So, ICSI is one step ahead of IVF. The preparation of the patient for the ICSI cycle is also the same as for the IVF cycle, and the further steps are also similar. It's only a lab part of the procedure where the sperm is injected inside the egg. We select the sperm under the microscope. There is a ICSI microscope which magnifies the sperm to 600 times more. So, you can select the sperm, which sperm is much more healthier, and that sperm is taken into the pipette and it's injected inside the egg. So, here is the difference between the IVF and the ICSI. In IVF, the eggs and the sperms, they are left in the petri dish to fertilize on their own, but in ICSI, they are selecting the sperm and injecting inside the egg to increase the rate of fertilization. In cases like in most of the clinics, either you divide eggs into half and half, like half for the IVF and half for the ICSI. Suppose in case if we are doing only IVF and none of the egg fertilizes, then we will not have any embryo to transfer. So, instead of taking that risk, we can divide the eggs half for IVF and half for ICSI, or if we have only very limited number of eggs, then not taking a chance, move on for ICSI, so that at least we have something to transfer.
Book your appointment on Pristine Care